Hello and welcome in. I'm Colette Wieland alongside Dr. Stephen Camarata. Steve is an author, professor, late talking expert. Today we want to talk about developmental intervention. It's a mouthful. So what is that?
So it's really interesting in my own journey as a clinician. There's kind of two different perspectives on intervention. And one is that there's kind of like this magic switch in the brain. And if you just do the right computer game, or you just take the right vitamin, or you just, there's lots of kind of crazy things out there, that'll unlock all this hidden potential. The reality is that intervention really is a journey where, with late talkers especially, they're going to go along, they're going to learn words, they're going to learn word endings, they're going to learn sentence structure, they're going to learn that, then it's going to translate into reading. And it's really a day-by-day, year-by-year journey. And it's really important that we understand that there's not a magic bullet where you just turn this switch. And so the first thing is that, to be sure, my mom tells me about how one day I just started talking in short phrases, and we certainly hear that kind of thing. And actually, I've seen that. I can prove that too with videos where that's happened in some of the cases we have. But even leading up to that, there was a lot of developmental things that happened. It wasn't like, I listened to a classical music piece and suddenly that unlocked talking in my brain. And so what's really, really important, and what we mean by developmental intervention, is that you look at the child's current abilities, current level of function, that's what we call it in the technical world, and we think about what's next. And we also think about all the different things they can be learning, and we think about, okay, what's the most important thing they can be learning today, this week, this month, this year, because we're building an adult and we want to continue on that journey. So developmental framework is foundational. There's not quick fixes. We're going to walk through this, and we're going to, teach the child as they go along and learn, and we're going to do that in a way that aligns with natural development.
What's the difference between a developmental interventionist and a speech language pathologist?
So a speech language pathologist is focused on, acquiring speech and language, and many speech and language pathologists like myself are developmental in their orientation. Some aren't. Some are more of the, do this particular kind of therapy and unlock a lot of other things. So one of the things I say to my students, to their annoyance, is that the S and SLP is speech, the L and SLP is language, and then we want to focus on speech and language, because some of my colleagues, they might do some kind of a program. For example, we know that children, many types of children with developmental differences, don't do clapping or rhythm things very well. So they do clapping and rhythm. It's like, well, that's not really talking. One time I went through a course where they were doing this kind of arm brushing, massaging to help speech, and it's like, that doesn't really make developmental sense.
Does it help?
No, but there's a belief system that it does, and you may encounter a speech pathologist or another professional who has you do that, and you want to be respectful. I always am, but you want to ask them, how is that connected to speech and language development?
What does it say? I'm not a speech language expert by any means. I would think you'd want to work on things.
You want to work on talking. I know.
Arm.
It's like you want to work on talking, and you want to work on listening and things that are and social communication. You want to work directly on the things that you're trying to teach. That sounds so simple, but it's really interesting. And I can guarantee parents that they're going to encounter, not necessarily speech pathologists, but different professionals that are going to suggest these other, things for late talking, like special diets, or again, the brushing of the arm is very, very common. A lot of the late talkers, someone will say, we just need to brush their arm, and do this kind of massage types of things, or put a weighted vest on them, or things like that.
Would those be considered sort of more naturopathic approaches to speech and language?
Maybe. I'm not, naturopathic, is not a well-defined term, but they're alternative, I'll just say it that way. And from my point of view, they're not evidence-based. I'm an evidence-based guy, late talker. You got to show me the data. That's how we are. I'm an empiricist, right? Exactly.
So what can parents expect working with a developmental interventionist or working with a speech language pathologist?
So developmental person is going to say, okay, here's your child's current skill set. So let's take a language example. So you'd say, okay, your child knows 10 words right now. We need to get them to 50 words so we can start having them combine words in what we call syntax or grammar. So we're going to work on vocabulary. We're going to teach that. And that's just how development works. Or you might say, oh, gosh, right now, whenever your child speaks, they're only using vowel sounds. We're going to have to encourage the development of more intelligible speech. We're going to help your child learn clearer speech in order for them to start being able to communicate in a way that you can understand. And we may actually use a picture system, or we may even use an electronic device as a bridge to that, but that's called augmentative communication. But the idea is we're looking at the child. It's child-centered. You say, this is where the child is. Here are the green flags. We talk about green flags, not red flags. We're going to say, here are the green flags. This is what I'm going to build on. And so it's a child-centered. And then the approach is to look across all the different things that child can learn and focus on the ones that are most important for them going forward and doing that triage.
Who should be the one doing the
Well,
work?
so the challenge there is there's a lot of different people who have this skill set. So what I would say, if it's late talking and you're trying to increase speech and language and social interaction, a speech pathologist is trained in that. That's a person. But special educators are fantastic. There's certain occupational therapists that are really good at it. Certainly there's child psychologists. The problem is really, there's not a particular person that has it. It's kind of a way of thinking, and that can happen with different professionals. But what you want is somebody who has that child-centered orientation and is looking at that child saying, okay, here's what they know, here are the green flags, and then here's what they need to learn next. Whoever it is that does that.
Is there a right time to get started, or is there something considered, it's too late?
No, so there's never a too late.
Okay.
There's this idea of neuroplasticity and its phase, and there's a germ of truth in that, but it's not nearly as rigid as people think. Please, if anybody says to you, hey, if you brought your child to me sooner, I could have done that much more. Just actually, I shouldn't say this, but just maybe not work with that person, because that's just not helpful at all, and it's not true. Not true. You want to, wherever, I have 9-year-olds that I work with who, their language level is of a much younger child, and so we just kind of keep them going. Children with Down syndrome or adolescents with Down syndrome have a vocabulary burst in their adolescent years. That's some research that came out of Vanderbilt. It's not my research. A colleague named Bob Hodap did that research, and his team. So yeah, you just want to meet the children where they are developmentally, and you don't want to say, that window is closed. That's not how it works.
How do you know if you're on the right path and
that's
your
where
right program?
Yeah, that's where you really want to question the person and their framework. So they should be able to tell you, this is my framework. You could tell from what I just said, I have some knowledge of speech and language development that's pretty specific, and I can map that on to different people that come to see me. And so that'll become really clear when you're talking to them. And what I do, you can just ask the clinician. You can say, okay, what do you want to learn now? Where are you going with it? And how long do you expect it to take? And they'll be able to answer that if they have a developmental framework. Now, how long it's going to take, in a way, you're going to do what I do is I'll when I first meet a child, I'll give the family some things to do. And then I have theories about how long it'll take. Well, a lot of times the child will go faster than I anticipate. Sometimes they don't. That means I need to adjust, and so you want to have somebody that's interacting with you and adjusting to the child. That's also really important. It's not a one size fits all. It's very individualized, and that's the key.
We've talked a lot about stage or a symptom. So when it comes to late talkers, will some of them outgrow the need to be with a developmental interventionist?
Yeah, they will. So what I say, some people have criticized me saying, well, you just say if it's a stage, don't do anything. I'm not saying that at all. I think, I always, like when a child comes in and I'm really confident it's a stage, it's not going to require long-term support, I'll still give the parents strategies to encourage the development. So you're always going to empower the parents to nurture their child's development and their talking development. And then you're going to keep data to see if it's unfolding the way you anticipate it. And you're going to give more support if the child shows you that they need it. But anyway, for a stage, yeah, the child's going to, unless you do something that derails development, they're going to start talking, and then they're going to catch up in some sense, for sure.
Is it ever something you've come across where a child gets the wrong type of intervention?
That is all too common. Mm-hmm. All right, so and I don't mean to be too negative to the autism crowd, but there's this theory of autism that you have to, when a child has autism, and you do have this in your toolkit in rare cases when the child has really low motivation, that you have to kind of force them to talk with a lot of prompting, and they're like food rewards and things like that. And, that can really traumatize a child. A case, there was a little guy I saw last month, and they actually, according to the parents, they diagnosed him with autism during COVID via video assessment. I don't recommend that because it's really important to get to know the child to have a good sense. They diagnosed him with autism. They put him in one of these really rigid behavioral force interventions. Kid had a meltdown the first day, basically had some really negative consequences. Mom and dad were just beside themselves. I saw the kid a few years later. It was a straight speech disorder, no sign of autism whatsoever. I know it wasn't an intervention because they withdrew. And so that intervention really was not right for that child. And I really hate that family went through that. I'm glad to say he's doing great. Kid is so social. And he's actually not too hard to understand. He's about a moderate speech disorder. But I mean, he is so conversational. He's constantly recruiting me to interact with him. He's so different than what we normally see in autism. So that accurate label is important, and then having the right intervention is important.
And can it further delay if it's the
It
wrong?
Yeah, it absolutely can, because the child is learning that adults are aversive, that social interactions are aversive, and then when they get into therapy, they're going to be. And I've even seen kids strapped in chairs and forced to talk. It's just very traumatic. And yeah, don't ever let anyone do that to your child. I don't care what. Don't let them do that.
I had an opportunity to talk to a mom of a late talking child, and she was just so worried about the choices she was making. Mm-hmm. Am I giving him the right interventions? Because progress doesn't happen overnight, In fact, this was a woman who had worked with you, and she said that by the time they saw you a few years later, you're like, look how far he's come. So what do you want to say to those parents? Not to worry maybe so much about making the right choices, right? Just
it's really profound, and so thank you for mentioning that. I always get great joy when I've been able to help families. It's important to me. So yeah, one of the things that happens is, so when they're like a toddler, it's words. And then, maybe when they're in kindergarten, it's maybe being in school, and they kind of forget, what it was like earlier. So I always show them videos, saying, okay, this is your toddler late talker, not talking at all, maybe having a little bit of a motor and running around, and now here they are sitting at a desk and struggling with some of the reading things, but they're talking pretty good. So I always try to help parents think about where the child was and all the progress they've made, because it's human nature. We're always looking forward and saying, okay, what else do they need to learn? And you're always, saying, oh, they need to learn this or that. And you're always comparing them to other children, and you kind of forget where they were before. So I really try to bring that to parents' consciousness and to celebrate the victories. Take pride in all the good things you've done, and don't beat you up for the things where you still got work to do. That's okay. That's kind of what comes with it.
So is it kind of a message, if you are seeing progress, then you're on the right course? Certainly,
yeah, that's true. And you want to kind of keep track of that, because that's going to inform how to optimize your support. So you always want to, it's not just your child has X, Y, or Z label by, it should be somebody who's a partner with you in helping that child's development. And that's the ultimate of development. That person's walking with you through the journey and giving you information along the way. As your child grows, then you're going to be teaching them different things within the developmental framework.
Thanks, Steve, so much for that. And thank you all for joining us, for tuning in. We so appreciate it. Of course, if you have questions for Steve, please comment in the comment section below. Click subscribe so that you can keep getting this information. Hit that bell. And of course, you can always 24/7 go to the Late Talkers Foundation website.
And remember, the best thing for your child is always you.